is the direction that Kenyans should take, especially when you're looking at, achieving what would be considered as universal health care, universal health coverage? And is it something that is going to be a game changer, as highlighted by a Member of Parliament here?
Now, the theory behind the Social Health Authority, because that is what SHA is sound, very sound.
Right.
I mean, we have the whole idea of universal health is a global movement, and we in the healthcare sector have wanted this for years. So the idea is very, very noble. In SHA, you remember there are 3 funds. There is the Social Health Insurance Fund, which is the one that really is getting money, because this money is being deducted from employees and going to SHIF as it is. There is another fund, the Primary Health Fund, which is supposed to be coming from the National Treasury. And this money should be available up to level 4 in the hospitals. How much has the government in this last year from Treasury allocated to the Primary Health Fund, so that when people go to that local health center, they are seen by a personnel, a healthcare personnel? Where are the healthcare personnel? They are literally on strike. You see them camping at Senate, people who had been taken on board because of universal health during the COVID situation. They are now jobless. So healthcare personnel across the country are highly demotivated and not able to properly deliver the service. The people are supposed to find that there is medicine at that level. What is the state there? But that fund is lacking enough money. And Mheshimiwa here, you should really challenge this budget which is coming. There should be money for that primary health care. Then the third one is the one that takes care of chronic diseases. Because today, the cancer, the high blood pressure, and diabetes complication, kidney failure, again, that is supposed to be funded from Treasury to meet those. Now, we have a scenario where only one fund, which is where people are being deducted. And by the way, the idea of deducting people who earn more is a good idea. It is a good idea. So the theory is good. Never mind what was wrong with NHIF, that we had to bury it instead of improving it. Did we have to spend 104 billion shillings to install a system that doesn't work?
It would have been safe to improve.
I must say, where we sit now is not where we were 6 months ago. I would recommend anyone who doesn't have SHA to join. Nobody should be discouraged from joining. Then we hold account. The issue is, we need to know this money, is it being allocated properly? Yes, it is being collected. Where is the input of the other 2 funds, so that people can receive health? When we say universal health coverage, what do we mean? Yes, you can allocate 120K. I know somebody who needs to go for a very important surgery, very important surgery that is life-saving. But the allocation is nothing. It cannot help.
Compared to?
You know, it is better than nothing. Universal health coverage means
it should be something
that when you go to the hospital, you find a happy clinician to serve you. You are able to get the medicines or the reagents that need to do the test, and you are able to be attended to, and you go home without being asked to pay anything. That is what it is. But the situation today, we have moved a step forward, yes, but people are still having to sell their cattle. They are still having to sell their
The idea is half a loaf is better than none. Is that what they're trying to say? Which?
The thing is,
well, if
if
that
there
half
was
is there,
real political...
health is exorbitantly expensive as we speak.
Dr.